Okay, so in year one, we learn articular pumping. I use it every day. There's not one client I don't use it for, and it produces amazing results when you start to master the technique and the theology behind it. So what it is basically, articular pumping is mobilization of fluid. The goal of the technique is to move fluid through the collagen tube, through the joint, through this, whatever you choose. There's over, I believe, 600 techniques for every ligament, every joint that you can use it with. So that being said, the first thing you need to understand when talking about pumping is what is inflammation and the cycles of it, because there is a time to use pumping and there is time to use ice. And basically there's three phases with inflammation. The first phase is the vascular phase, and there's two parts to it. When you first have an injury, you have a vasoconstriction. In other words, there's a shutdown of movement of fluid, you get a buildup of plasma, and that is a perfect time and the only time really to ice. And now they're finding with studies that actually that RICE protocol is only good for really 24 hours or less. After that, you get a vasodilation effect, where now the body's sending a lot of fluid to the area. You get the increased redness, you get the increased temperature, you get the edema. And this is a terrible time to put ice because you actually want the fluid to move. And that's where articular pumping comes in amazingly, day two. So you've iced the first day, now you come in and you pump the joint, you pump the ligament, you pump whatever's been injured. And what that helps to do is promote the healing, because although your body is sending fluid there, cells there to clean up the damage, to get rid of the waste, the problem with inflammation is it becomes chronic and it stays in the joint, and then you end up with damage to the tissue. So the goal is you do want the fluid, but you also want to move the fluid, and pumping is a great technique for that. Then you have the second stage, which is the cellular phase of inflammation, and that's also an amazing time to pump. So we use pumping for both those phases of inflammation. That's when your body's sending all the it's a hormonal problem, so they send all the hormones, the leukocytes, the macrophages, to clean up the debris, to clean up the damage. And again, you want that fluid to move, so you're going to use articular pumping as well. The last phase, which is the regenerative phase, is now your body wants to repair. This is the phase when people don't usually feel pain anymore, but the healing process is still going on. So you're still trying to use articular pumping to move the fluid, because you want the body to start bringing the amino acids there to repair the muscle, to repair the tendon, to repair the joint lining. And again, you're going to help that process with the pumping. The other way we use pumping is when you have a chronic injury, and you can use it to a specific joint, a specific ligament, when you want to pump more fluid and hydrate a ligament through the fascia, through the collagen tubes, through the synovium of the joint, when you want to create more space or move fluid out of the joint so that you have space to bring new fluid in. So we always also use it as that. If you have osteoarthritis of the hip, it starts to pump the hip to rehydrate all the tendons, all the ligaments, all the fascia, all the synovium, and that's the other way we use pumping. So this is actually pumping of the sacroiliac joint. You can be very specific, or you can be very general. And without giving too much of it away, the goal is you work with the client. So push the foot down into my hand, down to the floor, and release. Push. So right now I'm pumping the apex of the greater arm and the right SI joint, and release. And really what you're doing is you're creating pressure gradients to move the fluid. Okay? When you learn the biomechanics, the laws of the biomechanics, this will make a little more sense to you, but what you're doing is basically using the client's own muscle or intrinsic force to create pressure within a particular joint or ligament. I'm also providing an extrinsic force, and then she releases so that the fluid goes from an area of high pressure to low pressure. And that's basically the general gist of what pumping is. Push and release. You can pump the apex of the lesser arm. Push the foot up and release. Push, release. Push and release. Again, I'm trying to mobilize the fluid through the interosseous membrane of the SI joint to the lesser arm to allow it to move a little more freely. Push, release. You do the same thing with the hip. Come on your back. Okay. And this is how, when you know the fascial anatomy, the links and the relationships, you can start to think a little more globally of how you can affect the joint and what you need to normalize. So here I'm going to be pumping, you can pump the bursa of the psoas, the bursa of the right fem, you can pump the direct tendon of the right fem, you can pump there's an expansion off the right fem that's linked with the glute and the iliofemoral ligament, which is in the hip. And through that way, you can start to affect the whole joint capsule, the whole hip complex. So just push forward and release. It's a very gentle technique, painless. The results are amazing. In one session, the increase in range of motion you see, the decrease in pain, the decrease in swelling. But it's almost like magic. You sell clients on it instantly. You don't even have to say a word. Push and release. You can pump the recurrent tendon or the expansion of the right thumb. You can push that way. Just push and release. Push and release. And it also serves as a diagnostic, because now you're seeing if it's confirming your results that you've had with the pelvic assessment or with the test you've done for the hip. Push and release. Push and release. So it just confirms or further gives you a better picture, 3D image of what the structure is. Push